We are back on Morning Line. The number, if you want to join us, 737-7587. This is Dr. Alice Hoyt, and she is from Vanderbilt. Nice to have you on, ma'am. Thank you for coming on.
Let me be here.
We've got a follow-up question, but before we get to that, just the idea of the bees and all this. I know many people wonder about, hey, how about if I start buying local honey, which is a wonderful substitute sweetener, and it's good for you in a lot of ways, but they think it might help them with their allergies.
Yeah, there's really no evidence that honey is going to help with allergies. One reason there's probably no evidence is because a lot of the pollen that bees interact with, because bees go and hang out by the pretty flowers, and then that very sticky pollen from the flowers sticks to them, and then the little bee flies off. But that sticky, heavy pollen is not the pollen that's airborne, and it's the pollen that's floating in the air that people develop allergies to. And so they're not getting a lot of that airborne pollen in the honey.
Okay.
So it's not going to help very much.
If it did, like you were telling me before, it's just a little residual amount. My take is it can't hurt. And if you like to sweeten your morning tea with honey, fine. But I've used it as a beekeeper for years. And while I think maybe there's some placebo effect where I think it's helped a teeny bit, it has never gotten rid of my allergies.
No.
It just hasn't.
It won't.
I think you're right. All right, let's go to Anne had a follow-up question on the poinsettias. Anne, go ahead.
Yes, I go into anaphylactic shock when I am exposed to poinsettias. But years ago, I worked as a nurse, and when it happened to me at work in the hospital took the responsibility and banned them from the hospital. And I've always assumed I was not allergic to latex because I never had problems with gloves. It wasn't until about 7 or 8 years ago my doctor found out that saw research connected latex to the plant. Would it benefit me to be retested for latex, much the same as Nick could be allergic to the bee venom? That I never knew there was a connection, and I never thought I could possibly be allergic to latex gloves because I used them as a nurse.
Okay.
That's a really good question, and a lot of times the latex allergies occur when somebody has the exposure to it over a more prolonged period of time. So you hit the nail on the head, Miss Anne. Get retested. Come and talk with somebody. We have better tests now. In addition to doing skin testing, we can also do blood testing to really help sort out what this is, because this is really affecting your life, and we want to help you get this figured out.
By the way, is that why most hospitals don't have latex gloves anymore? Because there's such widespread allergies to it. Okay, and all right. We all know about the skin testing, you know, where you, is the blood test sounds like if you could just draw my blood and figure it out, I'd rather do that than the skin tests. Which is better, or why do you? Skin
tests and blood tests agree, meaning you'll get the same yes or no answer about 80% of the time. Skin testing is when we prick you with little bits of allergen right underneath this top layer of the skin. And what we're doing is we're exposing your IgE, if you have it, to different pollens, and it's positive if you get this red itchy bump there. What the blood testing does is it actually measures the IgE.
Okay.
And so they agree 80–85% of the time. Sometimes patients are dermatographic, meaning anytime you poke their skin or rub their skin, just a line on their arm, that will make a red raised itchy area. And so their skin testing is going to be sort of positive, not because they're allergic to everything, but because their skin is very sensitive. They're very sensitive. So that's when I would do blood testing.
Okay, but you wouldn't do blood testing first. You do the skin testing first?
Often we do skin testing first. Skin testing, you can't do skin testing if someone's on antihistamines. Because that histamine makes that reaction, and so it'll make our test falsely negative. So if a patient really can't come off antihistamines, then we'll just do blood work.
But why not just do the blood test first and you avoid all these other problems?
Some people like to do the skin test.
Who likes to do the skin test?
Sometimes patients like to see the reaction.
Okay.
And it does tell us something about sort of the functionality of your cell. It's telling us that, yes, when I put that cat right there, then you are having a reaction to it. Sometimes patients can have kind of low levels of IgE to something, and it's really not necessarily relevant. That's where really the history is so important. Asking the patient when their symptoms are, what do their symptoms respond to, all of those questions. The testing really is the other 10%. 90% of it is the history.
I gotcha. All right. Just in terms of when someone comes to the clinic, and they can come for a variety of reasons. Like if Amy Watson, for some reason, continues to try various over-the-counter allergy medicines and they just aren't working. Now, she could go and try to address exactly what her allergy is and try to get shots for it, but in terms of treating the symptoms, are there some newer prescription ones out there now that are more effective than over-the-counter? Not really? Not really.
Really what's going to make the therapy effective is taking it regularly. Whether it's a nasal steroid spray or an antihistamine, that's the way to really get effect from your medication.
Sometimes doing them both in concert.
Absolutely.
The pill, I've done that but there are enough different allergy pills out there with different active ingredients that you're going to probably find one that works, right?
If your problem is allergy. But if your problem is not allergy, then allergy medicines won't work.
And the only way to find that out is what? Go be tested, come and talk with an allergist. Okay, so if someone...
Sometimes it doesn't even take being tested. Like I said, gustatory rhinitis is when, rhin meaning nose, itis meaning inflammation of, and gustatory when you're eating. Some patients develop a runny nose when they're eating. That is not an allergy. That is an adverse response to the eating. It's more of a nerve issue. But we have medications that can help treat that. But if you're trying to take Zyrtec to help that, it's probably not going to help because it's not an allergic response.
So you're
it's more of a nervous system response.
All right, so when someone comes in, how long does it take? I mean, the bottom line, let's say someone today, and we're going to give the phone number for the clinic out at the end of the show, but they show up and they have an appointment. So the basic thing, I guess, they sit down at some point with you and you kind of talk first, right?
Yes, we talk first. So you'll come to our clinic, you'll check in, you'll have your vitals tested, and then you'll be put into a patient room where I'll come in, one of my colleagues will come in, and we'll talk with you about your symptoms. And that, again, that's where 90% of it is. And then in a joint discussion and agreement, we'll decide, should we do skin testing, should we do blood testing? We're also an asthma center, and asthma is an allergic disease, so we'll also think about, do we need to do some breathing tests here? And we can do all of that in the first visit. We do ask patients to plan to stay for a few hours, so that we have time to do anything that we may need to do in that visit.
You wouldn't necessarily do the skin test on that first visit?
Oh, yes,
or you
could.
Okay, now, part of the discussion I would think I'd have is, unless I'm having a life-threatening allergy reaction that leads to anaphylactic shock, in which case you probably do want to treat it, you have to decide whether or not you want to treat your actual allergy. Find out you're allergic to tree pollen. Well, I mean, do you really want to do shots to deal with that? Or just get yourself, if you don't have horrible reactions, just itchy eyes, a medicine for it, right? So you can choose, if it's not bad enough, just to treat the symptoms every season.
It's completely up to the patient.
Or you can go and maybe try to eliminate that from ever being a problem again by the shots.
Yeah, and this is why personalized medicine is so important.
I know, is that where you, how do you make that recommendation with someone?
I ask the patient.
And they'll just say, well, I just have it a couple months every year and it's not horrible. Can you give me a med? And that would be better than going through the regimen of shots?
It depends on that person's definition of better. If they're okay buying the medication and using the medication in every few months or for 4 or 5 months a year indefinitely, then absolutely. But insurance companies will actually pay for allergy shots even if a patient hasn't failed multiple medications, because the allergy shots will cure most patients of those allergic responses. And
you can put together a cocktail in the shot if you find from the testing that someone's allergic to 3 or 4 different things.
40 different things.
40. Interesting. All right, let's take a break on that note. Back with our final segment, maybe more of your calls, 737-7587, right after this.